I don't think anyone argues about the importance of physical or mental health, but trying to stay healthy during times of isolation or social distancing, that's harder. What if you're injured or not well at these times? Our guest today is going to talk about some of the things that you can do to stay healthy, to stay active, even during these crazy times that we're in right now. And we're going to talk about staying well on a long-term basis. So I'd like to welcome our guest today, Dr. Doug Pattison. He's a chiropractor, speaker, fitness trainer, and health advocate. For all of the doctors that I've met in my own life personally, I've actually never met a doctor of any field who is as passionate about physical and mental health as Doug is. So Doug is the doctor, the chiropractor, the practitioner at Pattison Health. And he's going to talk to us today about ways to stay active, maintaining your health, what to do if you need to talk to someone, a healthcare provider, and the ways that he's retooling his business to continue to serve as many clients as possible during these times and at all times. So welcome, Doug. It's great to have you here.
Hi, Barb. Thanks for having me.
Tell us a little bit about Pattison Health and where your passion comes from.
Well, Pattison Health started as a straightforward chiropractic practice in 1998 when I graduated from Canadian Memorial Chiropractic College, and it's morphed through several renditions since. Originally, chiropractors weren't allowed to advertise, so in order to advertise, we would have to go out and do community events and whatnot. So I would go to church groups to talk about headaches, or I would teach at a community college, or anytime a business was looking for a speaker, we'd get out there and speak. So that is how the speaking part came around. And as far as my own fitness journey, one day, Friday evening, my wife had been going to spin classes and her spin buddy wouldn't go. So she said, "Would you go with me?" And I said, "I don't really want to go. I'd rather just sit around on Friday afternoon, relax, have a cold one." She said, "Oh, I'd really like to go." I said, "Fine." So went to a spin class, and the personality that I have, I became an instructor 2 months later.
I was going to say, yeah, let me guess. You went as hard as humanly possible, were dripping sweat by the time you were done, loved it, and then took it over.
That's exactly right. Yeah.
Oh, okay, hit the nail on the head. All right, so that's many moons ago. Your wife took you out to that fitness class. Now you teach classes now as well, don't you?
I teach at the YMCA. I started teaching 4 fitness classes a week there, and I found that was just cutting into my family time too much. So we cut that down to 2. We do 1 spin class and 1 functional core class. And functional core is great because often people that have bad backs need that core work, or people that want to prevent injuries need that core workout as well. And we take 30 minutes and teach that class at the YMCA once a week.
So are you doing the class online now?
No, the YMCA, they've closed their doors, and we haven't really opened up the online yet. We actually just shot a video last week of that core workout that we do. It's kind of a condensed version. It's about 10 minutes long, but we're going to serve that up on our website, as well as make that available for YMCA members that want to participate in that core class.
That's a great idea. That's one thing that I know a lot of people are doing right now, is taking to the online world to see what they can find. Between Facebook and video and YouTube and video, there's so much out there in terms of what you can do. But I know myself, having been a sort of a retired CrossFitter, there's also a lot of don't do it that way because you're more likely to get injured. So how does someone decipher between, this is good and this is not good?
Yeah, that's difficult. It's difficult on several levels. One, there's actually several fitness instructors out there that teach as instructors, but not necessarily biomechanics. So there's a lot of exercises that are online that may look good on the outside, but actually by doing them, they're tearing your spine apart. But you won't know that often until the injuries have developed. So I often recommend talking to your healthcare professional, saying, these are the exercises I would like to do. Are they suitable for my condition?
Mm-hmm. And I think the one other thing that it doesn't take into effect is if you're predisposed to anything. So for example, you might have an underlying issue that, has never bothered you before, but if you start to do an activity and you consistently do it wrong, that underlying issue is all of a sudden going to become, a raging issue, and then you've really got something to deal with.
Well, that's actually how the exercises came around that we teach. A PhD researcher out of the University of Waterloo named Dr. Stuart McGill had found that people were suffering an episode of back pain. They would recover, but then within 6 weeks, their pain would start coming back, and they were starting to try and find this pattern. And what they actually found was the exercises that the healthcare professionals and the fitness instructors were prescribing for their condition was actually making them worse. So he developed a set of exercises he calls the big three, which are bird dogs, planks, and modified crunches, that he hooked his research people, his subjects, up to machines in his laboratory and assessed load on the disc and how the core muscles were contracting. And he found the ultimate concept, which was minimal stress on the discs and maximal contraction of the back. So that's how the safety of our program came out of that research.
Okay, so that's very interesting. Of course, you and I did some video work last summer, and we were working around those exact concepts. Talk a little bit about those 5 exercises, because, I'll be honest, the whole reason I retired from CrossFit is because of some back injuries that I had. And as you know, once I let it go, I just let it keep going and going. And one of these days, I'll get back into those planks. But it's a weird thing to lay in the middle of your living room when everybody else is watching TV and eating a bowl of chips. And, oh, don't mind me, I'm just going to lay on the floor and do some planks now. So talk to me about that social acceptance and, and finding ways to get that into your routine.
It all comes down to how bad you want it. Because if you want it badly, you will make it happen and you will put it into your routine. If you maybe don't want it so bad, sooner or later, your body will remind you that it's no longer a want, it's a need, particularly in recurrent conditions. So a lot of people suffer what's called episodic low back pain or mechanical back pain. And it's not rocket science in that what often causes this recurrent mechanical back pain are weak core muscles, because the spine is just a bag of bones without the core. And we can produce strong deltoids, strong pecs, big biceps, big quadriceps. And we often see that in the athletes we treat. But then when it comes down to it, the core was actually weak and that bag of bones wasn't supported. And often people get out of the shower, they bend over, they can't pick up their towel, and they come into my office bent over and say, well, doc, nothing happened. I said, well, actually, what happened was over the last period of time, your core became progressively weaker and weaker and weaker, and your body wrote a check that your core couldn't cash, and that's why you couldn't stand up.
That's such a good point. One of the times that I did hurt my back, I was in the middle of training for a triathlon, and I bent over to straighten out some blankets for our dog. My back, I call it seized up, and for months I was in pain. I wouldn't go so far as to say it was core related, because at that point I could actually count the ridges in my abs since I was training, but there was something else from an underlying issue that absolutely didn't have the strength it needed at that particular time.
Yeah, so back to your question of how do you put it into the routine? The way you put it into the routine is you take something every day that you do and you link your core exercise to it. So if there's a TV show that you like to watch, you reward yourself with being able to watch the TV show by saying, in the first commercial break, I will do it. And if that doesn't work for you, you say, before I'm allowed to watch my show, I have to do the core exercise. And it's like a switch. If the TV doesn't go on unless the core exercise is done. Or some people that don't watch television, I say, take your core exercises, and we have a little brochure that we give to all of our patients, and it's just about a little bit bigger than a credit card. And I say, put it beside your toothbrush. And before you touch your toothbrush in the evening, those core exercises have to be done. And I guilt people into it. I say, I want you to feel terribly guilty about brushing your teeth unless you haven't done your core exercises.
Hopefully that doesn't discourage them from brushing their teeth, though.
Yeah, the dentist will love me.
Exactly. You know, that's a great idea. You know, one of the things that I've done is on my computer, I can set what's called a Pomodoro timer. And so you can set the interval that you want. And so on an hourly basis, I take the last 7 minutes of every hour and do something. Sometimes it's as simple as, you know, get up from the chair, walk upstairs, fill up the water bottle, do whatever. But there's movement there, because for me anyway, I can sit and work for 10 hours straight. Like, I'll go to the washroom, maybe I'll remember to eat, but otherwise I can work straight through, which is terrible for your body. So I've had to, you know, trigger those reminders, fill up your water, eat, you know, move, that kind of thing. So one of these times with my 7 minutes, I'll be like, hey, I should do a plank.
Yeah, there's that whole concept goes into sedentary work. And, you know, you'll start hearing in the next while in the media, if you haven't already heard it, sitting is the new smoking. Mm-hmm. And it takes a certain number of years off your life for every year you spend sitting at your job. And one of the things that we're finding is if we can introduce mini breaks and micro breaks into your day, it really does help. So every 10 minutes, you just sit back from your chair. You don't even have to stand up, and just take a breath, move your fingers around, take your brain, just bring it off task, and then refocus it and go again. And then about once an hour, try and move your chair away, stand up, stretch your arms out, take a few deep breaths, refocus, and come back to your task.
Yeah.
The third part of that is the concept of sit-stand desks, or what we're trying to call them now is stand-sit desks.
Yeah.
Because we're habitual creatures. If you've been a work at the office type girl or at home for years and you're used to sitting, well, when you get up and get to that office, if that workstation is in the sit position, it becomes a sitting desk. And maybe you might remember to stand it up. But at the end of the day, when you're done, if you leave your sit-stand desk or your stand-sit desk in the standing position, you come to it that way, you work through it. We like to say about an hour of standing, 30 minutes to 60 minutes. And then if you need a sitting break, sit for 10 or 15 minutes and then stand back up again. Because we as humans were designed to be standing creatures, not sitting creatures. Yeah, so we just try and keep that concept of standing as opposed to sitting. And if we were designed to be sitting creatures, we would all have backsides that are this big, and we were designed to stand. And in 1,000 years or 1,000,000 years, as evolution takes us, we maybe evolve into a sitting creature. But right now, we're still designed to stand.
Exactly. I don't know if you can tell, so I'm actually at my stand-sit desk right now, and I am standing. I agree with you. If you leave it in the standing position, you're much more likely to stand. I also find when I'm doing meetings and conference calls and Zoom calls, it's easier to stand versus sit. Now, what's interesting is when I first set up my desk like this, it was a lot more work to move it into the standing position because I had to move a whole bunch of stuff, right? I had to move my standing mat. I had to pull something from somewhere. The more work it is, the less likely we are to do it. So I've actually, fashioned a carpet over my standing mat. So even if my chair ends up on the standing mat, it's not the end of the world. There's nothing that inhibits, like my cords aren't too tight. So I can just lift it up now. And it's made a huge difference in terms of how often I will stand. If you're not used to standing to work, there's a really interesting mental shift that happens, because for so many of us, when we need to concentrate, we sit down. And I have a number of colleagues who say exactly that. When they need to do really concentrated work, they still need to sit down. And I don't find that so much, but there's definitely times where I'm like, I need, a certain stack of papers, or I need a certain stack of notebooks. Now I really feel like I just have to sit down so I can get this done. And I think those shifts still need to happen for folks. because not all of those, mechanisms are sort of naturally in place for us yet, right?
Yeah, I totally agree. Yeah.
Okay, so tell me a little bit about Pattison Health. Obviously, it's your business. How are you balancing it all? You're teaching fitness. I know you serve patients here in Regina as well. You're out in Lumsden. How are you fitting all that in?
Well, the schedule has opened up time-wise because we've gone from seeing anywhere from 25 to 30 patients a day to between 1 and 4.
Yeah.
So that's opened up quite a bit of the schedule. Between the end of March and the beginning of June, we had 12 speaking engagements booked at conferences, and every one of those has been canceled. And most of those they've just put the event off until the fall. So it's left a lot of time for us to retool. And the biggest part we're working on right now is creating an online presence, because the best advertising I've ever had is word of mouth, right? Someone tells someone who tells someone that you do a good job and they come to see you. But right now, with the hands-on part of our practice not existing, a lot of people don't understand that we have a nutrition, exercise, and lifestyle consulting part of our practice.
Mm-hmm.
And part of the chiropractor's scope of practice in Saskatchewan is nutrition, exercise, and lifestyle consulting. Thus, anything that's part of the scope of practice as a Saskatchewan chiropractor can be covered by insurance benefits. And temporarily, our association has allowed us to do teleconferencing. So this has created a really unique niche market in that people right now have the time to focus on their health, and they can get a nutrition, exercise, and lifestyle coach covered by their benefits packages. So this is the perfect storm of, there's always the excuse. We don't have time to focus on our health. Well, now you have the time. Well, I don't have the money to hire a coach. Well, now you can hire a coach that's covered under your benefits package, which costs you very little. So this is the perfect time if somebody wanted to hire a coach to focus on their health, that they can actually take the 21 days it takes to make a habit and do it right now.
Mm-hmm. And that's a really good point. We were having that conversation at home the other day. Health insurance companies, you can't see the dentist, you can't see a chiropractor, you can't see. The list goes on and on and on. So in some ways, the insurance companies are kind of making out good in this particular situation. And I don't know how that's going to work for a lot of people if you have personal insurance versus group insurance. So it'll be interesting to see how all that works out. But talk a little bit about the coaching that you do with clients then.
So what we do is we are currently allowed to work with any patient that we've worked with in the past to work as a chiropractor. So we had to have done a consent and done a physical examination. So basically anybody that's seen us within the last year, which still leaves us with 2,500 to 3,000 patients to work with in our active patient role. So what we're going to do this week is start contacting these people that we've worked with and say, this is a unique opportunity. Would you like to take advantage of that? And people that haven't been in our practice before, we can do the same role. We just can't function as a chiropractor, because my background is a fitness instructor and a speaker. We've taken all of these years to develop our skill set. The only difference is then I'm called a health coach, and it's not covered under the benefits package. But some people also have flex spending accounts that they can use, or they're still working and there's cash in the bank and they say, you know what, now is the time that I want to change my health.
Yes. Well, and it's kind of a good time to try and make some of those changes, right? Because you actually have a little bit more what I would call thinking time on your hands, as opposed to, you're constantly running around, dropping off the kids, picking up the kids. There's just a bit of a slower pace right now. And so, if you're looking to make some of those kind of changes, I can see that it would be a good time. Talk about, your own business. You're doing some retooling, you're doing the coaching, you're going to reach out to past clients. I assume that means that you've kept some team members on board and have access to all these email addresses so you can reach out to folks. How are you doing that?
Well, what we've done is we've chosen to lay off our staff. And because the wage subsidy is still quite a gray area right now, we don't know if the government's going to support us in that. And right now, our income is 5% of what it was. So once that gets clarified, we will bring staff on to start helping us go through that. But right now, I'm just going to the office. It gets me a break from home. I'm only a 7-minute walk from our office. So I walk down to the office and fire up the computer and get in there and just start going through our database, phoning people that we don't have their email, get their email, and just touching base with our patients. And boy, do they ever appreciate that call coming from the people they trust when you don't have to phone them and just say, hey, how you doing? And even people that we aren't necessarily marketing our nutrition program or exercise program to. It's just somebody that had a bad sciatica a month ago and we were working on them when they were in the throes of it, just seeing how they're recovering from that. They truly appreciate those calls.
Yeah, I can see that they would. I was talking with another business owner on a show a couple of weeks ago, and she said the exact same thing. They were picking up the phone, they were calling people that they hadn't talked to, possibly since the previous year. And she said the same thing, like people just appreciate the fact that you're reaching out, you're talking to them, you're checking in with them. This is a really weird time for all of us. And, we can't have that human to human contact. And so we're actually searching for other ways to stay connected to people. And sometimes it's as simple as a phone call or a video you might put on your Facebook page, but anything that allows you to stay connected, I think makes a huge difference in both your physical and your mental health right now.
Well, yeah, that's where it comes down to. This is turning out to be a mental game. The beginning of this, the whole reason we're separating is so we don't get sick. So COVID-19, the virus right now, will make you sick if you get it. But by isolating, you may not be well at the end. And so there's a difference between being sick and being well. And we want to come out of this as a society as being well. We actually started a Facebook group called #3thingsforyou. And it was actually as much for me as anybody, because I was finding I wasn't coping well. The middle of the first week, I realized after 5 days, I hadn't shaved, showered, or changed my pants. So I wasn't coping well, and I thought I was. So I reached out to my friends on Facebook and said, listen, I'm going to do something for my health, my home, and other people, and I want you to keep me accountable to this. And when I checked the other day, we had 417 members. Nice. So it's really been coming, and it's people motivating others. And we've got people from Newfoundland to British Columbia that don't know each other that are helping to support.
That's a fantastic idea. Is it a public group that others can join? And what was the group name again?
It's called #3thingsforyou. And what it is, it's a public group that you have to ask to become a member of, just so we can keep the comments relevant. And so you just have to ask a trivia question to become part of the group. Or if you don't answer the trivia question, then we just have to approve you manually. So it's open to the public. It's considered a private group, but we're accepting anybody.
Okay, that sounds awesome. Doug, we're actually at the end of the show here. So I'm going to quickly ask you to share the rest of your contact information, and then we'll close out here.
So to get a hold of us online and to access our online booking, it's pattisonhealth.com. Our phone number, which we do use, is 306-731-2587. And if you need emergency chiropractic care, or you just want to talk more about our nutrition, exercise, lifestyle programs, the phone is still the best way to get a hold of us.
Okay, that sounds awesome. That brings us to the end of another show. So Doug, I'd like to thank you for joining me today. It's nice to see your kitchen, my office in the background. It's interesting seeing everybody's kind of working environment right now. But thanks for sharing that information with us. And if you haven't already, think about joining the #3thingsfor, sorry, one more time, 3 things for.
3 things for you, and it's the number 3.
There we go, 3 things for you. If you'd like to be a guest on the show, you can email me at barb@googlegirl.ca or reach out on Facebook and Instagram at AboveTheFoldCA. Just a reminder, you can submit your questions in advance of the live show on our Facebook page. I'm your host, Barb McGrath, local business owner and Google Girl. Remember, you worked hard for your success. Don't keep it a secret. Bye for now.